Should you have a contralateral mastectomy? And what does that mean? When you have diagnosis of breast cancer, let's say it's in the left breast, sometimes patients want or should have removal of the other contralateral breast. Let's discuss the reasons why this might or might not be the right decision for you. If a patient has a diagnosis of breast cancer and they also have a genetic condition such as BRCA, an ATM mutation, P10 mutation, these are mutations that greatly increase your risk of breast cancer. So in those instances, it's often recommended that the patient have a contralateral, i.e. other side mastectomy. Now, some patients with these genetic mutations will opt for removal of both breasts even before a cancer diagnosis. Let's say you have a cancer once again on your left breast and you don't have a genetic predisposition to cancer. Should you remove your other breast? Reasons why patients want to remove the other breast include reasons such as just not wanting to deal with the stress and concern of having a diagnosis of breast cancer on the other side. If that other side is a very dense breast, or if the patients had lots of biopsies, they might just decide it's time for them to remove the breast. Another reason why women choose to remove the other breast is for symmetry purposes. If we are reconstructing one breast, whether it's with an implant or a body-based surgery, we will objectively get better symmetry if we remove the other breast. So that's another reason why some women choose to remove the prophylactic contralateral breast. Other things to consider though. Just because you have a complication on one breast does not guarantee that you're going to have a complication on the other side. Whether it's the cancer side or the prophylactic side, you have a chance of developing complications. What type of complications? Things like a bleeding event, an infection that could require antibiotics, a hospital stay, or even loss of the implant, issues wound healing. When that happens on the contralateral breast, meaning the breast that didn't have to be removed, I've seen patients in clinic questioning why they did that. Why did they decide to remove that breast and now they have these complications? So that's a decision that only you can make. Is the risk worth the benefit? If you do have an active cancer though, and you need to have some type of adjuvant treatment, whether it's adjuvant chemotherapy or adjuvant radiation, adjuvant meaning after surgery, oftentimes we recommend not dealing with the other breast, because if you develop a complication of the side that did not need to be removed, and then it delays your cancer care, that can be very detrimental for outcomes. So these are all things to discuss with both your breast surgeon and your plastic surgeon. Did you have a prophylactic contralateral mastectomy? Let me know.